Screening tool for sepsis. What is best practice? An expert review conducted by Martin and colleagues found sepsis to be one of the leading causes of death in hospitalized patients. The rates of sepsis increased from 13 to 78 cases per 100,000 between 1998 and 2003. Currently, it is estimated that there are more than 1 million cases of sepsis among hospitalized patients each year in the United States. According to Winterbottom, there are recent evidence-based guidelines which outline strategies for the management of sepsis. Qualitative studies have shown that the early implementation of these guidelines improved the survival rate of the septic patient. Specific management protocols for the treatment of sepsis exist in the emergency department as well. However, early recognition of sepsis continues to be a constant obstacle to protocol implementation. To improve the identification of the septic patient, a simple and easy-to-use sepsis screening tool was developed for utilization by bedside nurses. The sepsis screening tool is based on numeric thresholds and algorithm-style prompting for making a diagnosis of sepsis. This highly sensitive and highly specific screening tool has been shown to decrease sepsis-related mortality in patients. This tool screens for systemic inflammatory response syndrome, infection, organ dysfunction, and severe sepsis. The first section screens for systemic inflammatory response syndrome. This includes objective vital signs and labs. If the patient has 2 or more, they are then screened for infection. The second section screens for infection. Does the patient have a suspected or documented infection? Has the patient received antibiotics in the last few weeks? If one is confirmed, the patient is then screened for organ dysfunction. The third section screens for organ dysfunction. If any of these exist, in addition to positive results from sections 1 and 2, this indicates severe sepsis. An observational study was performed by Kilborn and acquaintances on 6,500 emergency department patients seen in a rural Kentucky hospital between January and March 2012 in order to determine if sepsis was being diagnosed and treated promptly. After a comprehensive search of the electronic medical record database, it was discovered that 42 of the 6,500 emergency department patients were admitted with suspected sepsis. Of the 42 records reviewed, 21 met 2 or more of the systemic inflammatory response syndrome criteria. 13 of those 21 had vital signs indicating clinical criteria for systemic inflammatory response syndrome. However, only 3 of the patients admitted to the hospital had been diagnosed promptly and treated in the emergency department for sepsis. After a nursing screening tool was initiated and implemented by nursing staff in the emergency department, there was a 37% increase in the prompt diagnosis and treatment of the septic patient. Additionally, a quasi-experimental study was performed by Moore and Pierce on 927 patients admitted to the intensive care units at the Methodist Hospital in Houston between September 2007 and January 2008. This study was to determine if aggressive nursing screening for sepsis improves early recognition of sepsis and decreases sepsis-related mortality. After a comprehensive search of the electronic medical record database, it was discovered that following the implementation of a nursing sepsis screening tool, the mortality rate from sepsis decreased. The mortality rate related to sepsis in the SICU decreased from 35.1% to 24.2%. Sepsis mortality did not decrease in patients within the ICUs where this screening tool was not utilized. CVICU remained at 21 to 24%, and MICU remained at 37 to 38%. In spite of strong evidence that early sepsis management is critical in the positive patient outcomes, the early identification by healthcare providers remains challenging. Bedside nurses often miss the early signs and symptoms of sepsis, and time-critical interventions are delayed. Nurses need a prioritized, evidence-based tool that could identify quality indicators to produce the desired clinical outcomes. The simple implementation of a standardized screening sepsis tool would prompt the nurse and aid in the early identification of the septic patient during routine assessments. This would optimize the treatment process of the septic patient and improve patient outcomes.